Welcome to today's discussion about gout, a painful form of arthritis that affects millions of people worldwide. While often misunderstood, gout can have a significant impact on quality of life, so it's important to understand its symptoms, causes, and when to seek medical attention. Gout typically announces itself through sudden, severe attacks of pain, often striking in the middle of the night. The condition most commonly affects the big toe, but it can occur in any joint of the body, including ankles, knees, elbows, wrists, and fingers. These attacks are characterized by intense pain that reaches its peak within the first 4 to 12 hours. The affected joint becomes swollen, tender, warm to the touch, and noticeably red. What makes gout particularly challenging is that even after the severe pain subsides, joint discomfort can persist for days or even weeks. At its core, gout occurs when urate crystals accumulate in your joints, leading to inflammation and intense pain. These crystals form when there are elevated levels of uric acid in your blood. Understanding this mechanism is crucial because it helps explain why certain risk factors contribute to the development of gout. These risk factors include dietary choices, particularly those high in purines, excess body weight, certain medical conditions, and some medications that can affect uric acid levels in your body. The condition tends to run in families, suggesting a genetic component to gout susceptibility. Age and sex also play important roles, with men being more likely to develop gout at younger ages than women. However, women's risk increases after menopause. It's worth noting that recent surgery or trauma can also trigger a gout attack, making it important to be aware of these potential triggers if you're at risk. As gout progresses, it can lead to more frequent attacks and affect multiple joints simultaneously. One of the most concerning aspects of chronic gout is the potential limitation in range of motion. Over time, untreated gout can cause permanent joint damage and make normal movement increasingly difficult. This underscores the importance of proper medical management and early intervention. If you experience sudden, intense joint pain, particularly if it's accompanied by swelling and redness, it's crucial to seek medical attention. This is especially important if you develop a fever or if the joint becomes hot and inflamed, as these could be signs of infection. Remember, untreated gout can lead to worsening pain and permanent joint damage, so early diagnosis and treatment are essential for managing this condition effectively. The good news is that gout is a manageable condition with proper medical care and lifestyle modifications. Working with healthcare providers to develop an appropriate treatment plan, maintaining a healthy diet, and managing risk factors can help prevent future attacks and protect your joints from long-term damage. Understanding your personal risk factors and recognizing the early signs of a gout attack can make a significant difference in managing this challenging condition.